Well, the 17th was a Friday, and you don't count the weekend. So I had 5 whole days to sit and wonder and wait. That was mental torture because you don't know what the outcome is going to be, and then what if the outcome is what you don't want it to be. April 22nd comes along. They do indeed tell me that I was diagnosed with cancer. I was not necessarily in denial, but my family history, 4 generations on both sides, no history of cancer. We have hypothyroidism, hyperactive thyroidism, diabetes, and high blood pressure. That's it. And I spent my whole life fighting against those things, eating right, exercising, hydrating, the whole nine. I'm the junk food police and the health food junkie. So out of all people in the family to get a cancer diagnosis, it was a shock to me and my entire family. However, it did make everybody else line up and do what they should have been doing all along. So for that, I was grateful because I was the catalyst. I never really questioned God as to why He chose me to do it. I was just obedient to the journey. I couldn't understand, again, in 4 generations on either side, how suddenly cancer showed up. Well, I found out because the same blessing of my mom's side of the family with the dense breast tissue, they actually start to ovulate and have menstruation early. They go through menopause early. So at 40, I was given hormone replacement drugs. At 45, when I was diagnosed with cancer, they had to stop them immediately because I tested triple positive, which is positive for estrogen, positive for the carcinoma, and positive for the progesterone, which is also in HER2, which is also another protein. So between those diagnoses, they're like, oh, the hormone is going to feed the cancer. So within 2 weeks' time, my mass grew from a small 2 millimeters to like 8 millimeters. Because during that 5 days that I was waiting, I was still taking the hormone replacement drugs. Even after I got the diagnosis, they couldn't tell me exactly what it was. I had to wait another 2 weeks to go see the surgical oncologist. So the entire time I was still taking the hormone replacement therapy, which was feeding the cancer. Once I spoke with my my surgical oncologist, he explained to me what my staging was, what my typing was, what the plan of action was. Then I got sent to the cancer center. Normally, as Ms. Geary said, you get to partner with your physicians. So there's a camaraderie, an understanding, a meeting of the minds. With this particular doctor, not so much. He was very cold and I hated his bedside manner. And I'm feeling like this is the fight of my life. I cannot afford to not like my doctor. I need someone who's going to partner with me. I had 6 rounds of chemotherapy, 8 different drugs each round, 3 weeks apart. Some of the side effects that I experienced were fatigue, diarrhea, cramping extremely bad, to the point that I would spend 10 to 14 hours in my bathroom with Gatorade, Pedialyte water, and green tea lined up on the sink, just trying to hydrate my body to keep from cramping so bad. When I went to my doctor for my 2nd round of chemo, I asked him to give me something to help retain the fluids that I was taking. He looked at me and said, "You do realize we're pumping 8 poisons in your body to save your life, don't you?" In my mind's eye, I saw my hands around his neck. I saw him turning red and purple and then black before I turned loose. But I was so weak, I couldn't do anything but sit there quietly and just take it all in. So after I finished my 2nd round of chemo, I looked at my then husband and said, "I need another doctor." So we made an appointment for another doctor within the same practice, and I felt mentally better about at least having another avenue coming back for my 3rd round. Well, mysteriously, that appointment went up into the atmosphere somewhere, and I ended back with the same oncologist, and I never opened my mouth that entire appointment. And I told my ex-husband, I would die before I come back here. Now, God has already said this is not unto death, so I don't know what we're doing, but I know what we're not doing. From this before, we're not coming back here. So he found CTCA, Cancer Treatment Centers of America in Noonan, Georgia. And I went there by the time it was time for my 4th round of chemotherapy. They agreed with everything that the doctors found here. They agreed with the regimen. However, the problem was 2 of the chemotherapy drugs I was taking, the #1 side effect was diarrhea. I was getting both of those drugs at 100% dosage. Here, they didn't necessarily have the 100% dosage, was way too much for my body to handle it. So my oncologist dialed one of them back 15%, one of them back 20%, and it scared the living life out of me because I didn't go to the bathroom for 3 days. My life had been sitting on the toilet for 10 to 12 hours a day, suddenly not going for 3 days, and I'm like, what's happening? So I called him in a panic, and he was like, oh, it takes 3 to 4 days for your body to adjust, just give it an extra day. And from that moment on is when I actually started to feel some normalcy in my life again. For 15 weeks, I had no life. I couldn't eat, I couldn't sleep, I couldn't come out the bathroom unless I went to take a shower or to do laundry because of what was happening in the bathroom. And so I really just had absolutely no quality of life. I was doing homework with my child via iPhone. I'm in the bathroom, she's in the den trying to do homework over FaceTime. Just different things to try to give her some normalcy. I have 3 children, 2 at the time adult children who are out the house. My middle child was a senior at Alabama, and my baby was starting her high school career. So the baby was the only one physically at home experiencing all the changes, so she was the one with the mental and emotional impact, more so than the other 2 who kind of out of sight, out of mind as adults. But for her, I wanted to try to give her some sense of normalcy because she was gone. Meanwhile, going to CTCA, whereas going here, pride got in the way because I'm looking at these silver hair, gray hair, white hair people walking in here, looking like they're getting extra life going through chemotherapy, and I'm getting IVs in my arm, and I'm feeling like I'm about to die. Well, little did I know, most of them were getting like they were vitamin infusions. I was going for something totally different. But when you're in the midst of it and you're looking around, and of course you can't ask people their medical business in a big platform, then you make assumptions. I saw the same silver-haired lady at CTCA leaving chemotherapy teaching Zumba, and I'm like, God, something's wrong with this picture. Like, I can't get out of the car to my bed, to the, without stopping by a bathroom. How's this lady teaching Zumba? Well, it was because they were able to treat us as individuals and dial our medications and our treatments to what our body could withstand. There I had teams of doctors. I had specialists in every area. I had a pain management team, had an oncology team that dealt strictly with the cancer. I had a breast surgical team that dealt strictly with the removal of the breast, a whole different team for reconstruction, a different team for radiology, a pastoral care team that prayed with us every time we went into the facility. And then you had a mental health team. So just having that many people around you whose common goal is to get you through this and to help you feel better when your body image is destroyed. Because I thought with the cancer diagnosis I was going to lose at least 15 pounds and be back in my skinny jeans. Instead, I ended up with excruciating migraines, which they were giving me steroids for, and I ended up gaining 52 pounds. So now I'm miserable, fat, bloated. I look like Tim Allen Santa Claus with a plastic face. And I'm like, guys, something has to give. I'm not complaining. I understand this is for a purpose, but just help me through this. Well, fast forward, I made it through chemo radiation, made it through 40 rounds, chemotherapy, made it through 40 rounds of radiation and 4 different reconstructive surgeries. On this side of it, I'm very grateful because I have opportunities like this to talk to people, to mentor people. I'm a certified life coach now through CTCA, so I get to mentor other breast cancer patients as they come into the facility and their families. I have a patent for a medical device that God gave me after those hours of sitting in the bathroom wishing I had some help. And that will help so many people once it's out on the market. And then I was able to start a cancer ministry at my church, which teaches people what to do, what not to do, what to say, what not to say, and how to really help not just the patient, but the whole community at large that's being affected by cancer.
So you talked about your physical. Talk about your mental. How did mentally,
okay.
How were you able to cope? How were you mentally every day? How were you mentally saying that God, I want to give up? How did you do that?
I never really wanted to give up. I just asked my can the pain stop just for a little bit? But for me, I decided it was a win-win. Whether I open my eyes every day on this side and God gave me an opportunity to fight through again, or whether I close my eyes eternally and I got to see Him and Jesus. it was a win-win for me. So because I came in the whole journey with a win-win attitude, I'm like, there's no way I can lose in this. So it helped me build my faith and build my confidence to stay fighting on this side. Every day I open my eyes, I'm like, okay, God, you're not done. Okay, there's something else for me to do. There's something you have on the other side of this. Because as his children, the enemy can only attack us if he allows him to attack us. So I understood that this really wasn't about me, although I was enduring it during the season, that ultimately it was going to be for someone else.
So you being so independent and then have to depend on somebody, how did that affect you?
Well, I had a good support system with my parents, and to a degree with my ex-husband. He was an excellent financial support system, because cancer, again, is not a sprint, it's a marathon, and so you have long-term medical bills. God really blessed him and positioned him to be in a financial state at an early age, that once this battle hit us, we were able to sustain it. Emotionally, my daughter, the youngest daughter, would be the person that God used to really just speak life into me. And she was, Mother's Day, she gave me a card with Gloria Gaynor's I Will Survive, and I just wept like a baby, because she's like, Mom, you're the toughest person I know. And I needed that in times. And then I would have church members who would come out of nowhere and say, you know, you're beautiful, on days that I just felt so ugly and unworthy. So it was mental and emotional. But God always had someone there to speak a word of encouragement to me on my very lowest days.
So if you had something to say to those young ladies that's going through what you went through, what encouraging words, or what would you say to them?
Always remember who you are and whose you are. The battle isn't yours, it is the Lord's. If he pulls you through it, it is for a testimony to help someone else. It does not feel that way when you're going through, but you have to encourage yourself. You have to be like David and encourage yourself. You have to press forward and fight. And as believers, you have to know that even if we transition on the other side, it's still a win for us. Amen. Amen.
As my next guest come up, I want to tell you, my mother was one of the strongest ladies that I met. Just seeing what these young ladies are going through, and I tell you, they're young. So, and as a man, we must understand what they're going through, and we must be supportive, but we have to understand how this cancer affects so many people. So now I have my next guest. You want to introduce yourself and tell them how I know you?
Hello everyone, my name is Sharnitra Stevenson. This is actually one of my elementary school teachers. And due to COVID, I actually haven't spoken at any breast cancer awareness events. And when I seen his post, I was like, I think it's too late, but I'm still gonna message him. And I inboxed him, and he was like, he would love to have me here. And it's my pleasure to be here, because I was 23 years old when I was diagnosed with breast cancer. I had a 2-year-old son at the time. How I found my lump was, I always did self-exam. And one month I found the lump in my breast, and I asked my doctor about it. And he was like, well, you're only 23, it can't be much. And I was like, no, I need a second opinion. And so he did me a referral, and I went to Jackson Emmy Center. And my mom had to keep my son, so I went by myself because I was a single mother at the time. And when I went in, they were like, you so young, you got dense breasts, so we see something there, but we don't know what it is. So they said, we could do a mammogram. So I did a mammogram, and when they left out, I just started praying. I said, God, I don't know what you have for me, but I just want to survive because I have a child. And God is like, God was literally standing in the room with me. And he was like, this battle is not yours, it's mine. He said, your testimony is going to save so many people's lives because of the strength you have through this battle. Amen. So every time my doctor came and faced me, I was young and I was there by myself because my mother was keeping my child. And he came and he said, Miss Stevenson, you seem so strong every time I talk to you. I said, because God already confirmed to me that this battle is not mine. And so I ended up getting biopsy done, and mine was actually on a Thursday, like one of my survivor sisters came up there, so I had to wait over the weekend. And I'll never forget, May the 28th when I got my biopsy done. They called me back that Monday. I was laying across the bed with my mom and my son. And it was actually my doctor that called me that told me it couldn't have been much. And he was like, Miss Stevenson, I'm sorry, but you have breast cancer. And he was like, I'm so sorry, but I appreciate you standing up telling me at what I do that you want a second opinion. And so I told my mom, and she was like, you okay? I'm like, yeah, I'm okay. So as I went on, I never cried about it. I never felt sad about it. I just knew the battle wasn't mine because I trusted God. So my mom started going to the appointment with me because my son ended up going to daycare. And the daycare, she was like, she didn't charge me. She just said, I know what you're going through. I'm going to be your support when it comes to your child so your mom can support you. Amen. So I was seen by 3 doctors, and they told me I was at stage 1, and they said, they was like, we could just take the lump out, and you'll be okay. I said, no, I want a double vasectomy, take them. They turned against me. And he's like, you don't want no breast? I said, I don't want them. So I ended up having a double vasectomy. I was in surgery over 8 hours. When I came out of surgery, my family was there. After I had surgery, I ended up going to see my doctor at the Councilor Center. He was like, everything okay? And he was telling me that it was a 90% chance that cancer could return anywhere in my body. He was like, if you take a shot every month and take a hormone pill every day, it will help lower your possibility to change. So I was like, I don't like medication, but if it was going to help me save my life to raise my child, I was willing to do it. So I ended up taking the medication. I did have to do radiation or chemo. So the hormone medicine, it made me, I guess, depressed. I was having hot flashes. I was facing a lot. So when I went back to the counselor, I said, if it's the Lord will for me to fight again, he'll help me survive, but I can't take the medicine. Amen. And so not knowing, my dad was praying that I stop it because we was Googling the medicine. They had so many side effects. My bones were weak. My hair was falling out. I was just depressed. And being so young, I'm already breastless and facing the community and people were staring. But I was never stressed about it. My support system was the biggest thing, from my job to family, friends, people I didn't know was praying and reaching out to me. And they was like, you so strong. But when I got to a weak point in my life, I said, how could I give up on myself when there's so many people believing me? Amen. And so I'm a 6-year breast cancer survivor. My son is now 9 years old. And life has been a blessing.
Now, you have some sisters, right?
Yes, I have 2 sisters.
So what awareness did they start doing, making sure that they don't do those mammograms, self-checks?
So, you know, they still put an age limit on it, which I really regret. Because if you have breast, you should be able to get a mammogram. Because cancer can come at any time. It's not an age limit. My sister, my older sister, she was still refused for a mammogram. Even though they're young. So we were like, I guess like, they got an age limit they could get it,
So did you have to do any of your family history for your medical? Did you do any research?
I went to Birmingham and I got a genetic test done. And if it would have came back genetic, my close relative told my mom and dad decided would have had to get regular mammograms done, but it came back not genetic.
Okay. So now for those young girls like yourself, what would you tell them for as encouraging them for as, you know, your support of your family? What would you say?
Do mammogram because it saved my life. I was 23 at the time. So if I waited till I was at the age of where I could get a mammogram, my life could have been gone. My son could have been coming to visit me at my grave. By me doing self-exam every month, I found my lump and I saved my life. So self-exam is very important. I even do self-exam on my son because guys can get breast cancer also. So my main thing is do self-exam. It's very important.
Thank you so much. second? Hold on, I think we got one. We got one thing. Thank you. So as you can see, that this is not just for the older generation. You see, most of the survivors that's here are young. So I just want to make sure that we promote the awareness of breast cancer. I am doing a drive. I'm trying to raise $5,000 for breast cancer before the end of the month, and I think we're halfway there. I'm working with Breast Cancer Research Foundation of Alabama. They have been wonderful helping me with this cause that we're trying to do. And I just want to make sure that we bring a light to what these women are enduring. So at this time, are we waiting? Want me to just bring the doctor on?
Go ahead, bring it.
Dr. Robinson, you can. Hello. Good evening. You can introduce yourself to the audience.
Good evening. My name is Dr. Brooke Robinson. I am a family physician with the Jackson Clinic. We are located on Carmichael Road, 4150 Carmichael Road, actually across from the Cancer Center. And I just want to thank Councilor Mitchell for the opportunity to come here and speak with you all. Today I will be talking about just some facts about breast cancer, signs and symptoms, risk factors, and screening. And I also want to commend the survivors on your strength and for sharing your story, because you give others hope who are currently in this situation. So I'll just start by saying that primary care has been associated with greater outcomes when it comes to breast cancer, simply because early detection is key. I encourage everyone to establish care with the primary care provider so that you can establish that relationship and start those screenings early. We try to make preventative medicine a priority, so that is very important. So just a few fast facts about breast cancer. And a lot of this information comes from the CDC, the American Cancer Society, the American College of Gynecology, and the United States Preventive Task Force. Every year in the United States, about 255,000 women get breast cancer, and 42,000 women die from the disease. Men also get breast cancer, but it is not very common. About 1 out of every 100 breast cancers diagnosed in the United States is found in a man. Most breast cancers are found in women who are 50 years or older. But as we've heard tonight, breast cancer also affects younger women. I have personally diagnosed a 19-year-old with breast cancer. Other than skin cancer, breast cancer is the most common cancer among American women. The lifetime risk is about 13%, and the incidence is actually about equal between Caucasian women and African American women. However, the mortality rate amongst African American women is actually higher. Mammograms are the best way to find early breast cancer when it is easier to treat and before it is big enough to feel or cause symptoms. So let's talk about the symptoms here. Any change in the size or the shape of the breast. Pain in any area of the breast. Nipple discharge other than milk, including blood. A new lump in the breast or even under the arm. If you notice any of these signs, you need to contact your primary care provider, your family physician, internal medicine, or your OBGYN immediately and let them know about these changes that you have noticed. Now we'll discuss some risk factors. When we're talking about risk factors, there are risk factors that you cannot change, and there are some that are actually modifiable, those risk factors that you can change. So some of the risk factors that you can change, that you cannot change. Getting older. The risk of breast cancer increases with age. Most breast cancers are diagnosed after 50. I said most, not all. Genetic mutations. Inherited changes to certain genes, such as BRCA1 and BRCA2. Women who have inherited these genetic changes are at a higher risk of breast cancer and ovarian cancer. Your reproductive history. Early menstrual periods before age 12 and starting menopause after age 55 expose women to hormones longer, raising their risk of getting breast cancer. Having dense breasts. I think we had a survivor to mention that tonight. Dense breast means that you have more connective tissue than fatty tissue, which makes it really difficult to find lumps within the breast. Personal history of breast cancer or certain non-cancerous breast diseases. Some non-cancerous breast diseases such as atypical hyperplasia or lobular carcinoma in situ. Family history of breast cancer or ovarian cancer. Previous treatment using radiation therapy. For instance, women who are treated for Hodgkin's lymphoma before the age of 30, that can increase your risk. Also, women who took the drug diethylstilbestrol, known as DES, which was given to some pregnant women in the United States between 1940 and 1971 to prevent miscarriage. Now let's talk about some of those risk factors that you can actually change. Not being physically active. Women who are not physically active have a greater incidence of having breast cancer. Being overweight or obese after menopause. Taking hormones. Your reproductive history. Having the first pregnancy after age 30. Not breastfeeding. And never having a full-term pregnancy can raise breast cancer risk. Drinking alcohol. Studies show that a woman's risk of breast cancer increases with the more alcohol that she consumes. Research suggests other factors such as smoking, being exposed to chemicals that can cause cancer, and changes in other hormones due to night shift working may also increase breast cancer. Who is at the highest risk for breast cancer? Those with a very strong family history of breast cancer and those with the BRCA1 and the BRCA2 genes. So if that's the case for you, you definitely need to meet with your doctor and discuss that. Ways to be proactive when it comes to having those genetic mutations. So what can we do to reduce the risk of breast cancer? So we talked about the modifiable risk factors. That's what you want to target. You want to target the things that you can actually control. Keep a healthy weight. Exercise regularly. Limit your alcohol intake. If you're taking hormone replacement, talk to your doctor about that. Maybe you need to consider some other options. Breastfeed your children if possible. So now we're going to talk about some of the breast cancer screening recommendations. And I just want to emphasize that depending on the medical society, how your physician feels about it, different societies have different screening guidelines when it comes to breast cancer. So I'm going to give you about 3. I personally like to use the American Cancer Society. This society recommends that women between 40 and 44 start to go ahead and get those mammograms actually every year. And without a doubt, women 45 to 54 should get mammograms every year. The United States Preventative Task Force recommends that women who are 50 to 74 and are at average risk for breast cancer get a mammogram every 2 years. So if that's a society that your doctor follows, then that's what they'll be doing. So you want to make sure that you understand which guideline your physician is actually following. The American College of Gynecology recommends that women at average risk of breast cancer should be offered screening mammography starting at age 40 years. If they have not initiated screening in their 40s, they should begin screening mammography by no later than age 50. And that decision should be made based on risk factors. Beyond age 75, the decision to discontinue screening mammography is actually up to the patient, and that's a discussion that you'll need to have with your doctor. If the life expectancy is expected to be at least 10 years or more, I would recommend that you continue those mammograms. And as always, like one of the other survivors said tonight, breast awareness is so important. Checking your breast, checking for any changes, any lumps or masses, even under the arm, any discoloration, if the nipple inverts or you start seeing discharge. You just want to be very aware of your body and let your doctor know as soon as possible. In that case, it won't be a screening mammography, it will be a diagnostic mammography. We actually see an issue and we'll order a diagnostic mammogram.
So Dr. Robinson, how important it is to know your family history?
It's extremely important because if you have a strong family history of breast cancer, you will likely need to be tested for those genetic mutations, BRCA1, BRCA2, and you'll need to start getting your mammograms a lot sooner, really as soon as age 35.
Now, I know a lot of insurance companies won't pay for those until a certain age, but if you go to your primary doctor, is it a way to get those tests done earlier?
Absolutely. We will work with you. We will come up with a plan to get that covered for you based on your risk factors, based on any signs or symptoms that you might be having at that time.
So, doctors, is there anything that you want to tell the listening audience about breast cancer awareness or?
Early detection is key. Be very aware of your breast and establish care with a primary care provider. It has been shown to have better outcomes when you have established that relationship because it leads to early detection. And I thank you all for allowing me.
Thank you. I think we may have one more guest that's about to come on. She's calling all the way from, is it Atlanta? Is she on?
Yes, she's on.
We'll tell her to introduce herself and tell her story at this time.
She said, wait a minute. She's trying to move on.